Aerobic exercise is any physical activity that uses large muscle groups and causes the body to use more oxygen than while resting. Besides weight training, functional training also includes sprinting and high-intensity interval training. Exercises in flexibility stretch out muscles and lengthen them. As a result of the improved blood flow during exercise, dynamic exercises such as running tend to reduce the diastolic pressure. The goal is to improve range of motion, which can reduce injury. Exercise is designed to increase cardiovascular endurance and improve bone density and balance. It can improve flexibility in joints. It can also improve coordination and bone density. A static exercise, such as weightlifting, can cause the systemic pressure to rise significantly, albeit temporarily, during the exercise. Running can cause the systolic pressure to rise. When running or jumping, the systemic temperature can also be increased. It is also possible to raise the systolic pressure at the same time as running or jumping during a sprint. During a sprint, the systemic pressure can be increased. It can then be increased during the next exercise, such as a sprint and weightlifting, so the systolic pressure can then be raised again during a weightlifting exercise, such as lifting weights at a higher intensity, or during a sprint-type exercise such as. So systolic and diastolic blood pressure can increase. Health effects. A person who participates in moderate to high levels of physical activity has a lower mortality rate. A lack of physical activity causes diseases such as heart disease, type 2 diabetes, breast cancer, and colon cancer. Physical inactivity causes 9 premature deaths worldwide. 3,000 meters a week is the most effective for exercise. For example, climbing stairs 10 minutes, vacuuming 15 minutes, gardening 20 minutes, running 20 minutes, and walking or bicycling for 25 minutes on a daily basis would achieve 3,000 minutes each week. This is the equivalent of about 6,000 hours per day. This is roughly the equivalent of around 25 minutes of physical activity per day for a week. It is estimated that this amount of physical activity is needed to maintain a healthy weight, regulate the body, build and maintain bone density, and maintain muscle strength and mobility, and maintain saline balance. Pregnancy. Every week, pregnant women should get at least 150 minutes of aerobic exercise. An aerobic activity is one in which you move large muscles of the body in a rhythmic way, like those in the legs and arms. You can divide the 150 minutes into 30-minute workouts on 5 days of the week, or 10-minute workouts throughout the day. If you were active before you became a mother, you can keep doing the same workouts. During pregnancy, your body undergoes many changes. It is important to choose exercise that takes into account the changes. The hormones made during pregnancy cause your joints to relax. You can do this for 5 minutes a day until you can do 30 minutes a week. When you add weight to the front of your body, you shift your center of gravity. This puts stress on your joints and muscles in the lower back. Drink plenty of water, wear loose-fitting clothing, and exercise in a temperature-controlled room. Later in pregnancy, a belly support brace may reduce pain while walking or running. If you are pregnant, your need for oxygen will grow. As much as possible, avoid standing still or laying flat on your back. On the back of your uterus is a large vein that sends blood to the heart. A dehydration. The need for oxygen increases while you are pregnant. Drink plenty of water before and after a workout session. There are signs of dehydration that include dizziness, a pounding heart, and urinating only in small amounts. When you exercise, oxygen and blood flow are directed toward your muscles and away from other areas of your body. Immune system. Immune cell functions are impaired after acute sessions of high-intensity exercise, and some studies have found that athletes are at a higher risk for infections. Athletics and non-athletes generally have similar immune systems. In some athletes, natural killer cells and cytolytic action may be slightly elevated, but these are unlikely to be clinically important. Supplementation with vitamins has been associated with a lower incidence of upper respiratory tract infections in marathon runners. This may be because athletes have more lymphocytes in the body. Exercise interventions lower the levels of two important cardiovascular risk markers. Exercise interventions lower blood levels of fibrinogen and reactive protein in individuals with heart disease. Exercise interventions lower levels of fibrogens and cytoplasmic reactive protein, an important cardiovascular risk factor in people with heart disease and individuals with heart diseases, and in people who are already suffering from cardiovascular disease. Breathing exercise reduces stress. Inhaling oxygen helps to reduce stress. Without formal meditation and controlled breathing, yoga can reduce stress. Rapid and shallow breathing is a common response to stress, so regular breathing is a sign of relaxation. In fact, you can learn to control your breathing so that it mimics relaxation. Practice it in advance, then use it when you need it. If you find it helpful, repeat the exercise 4 to 6 times a day, even on good days. Even on good days, practice the routine before going out for the day, and then again after you get home. You can also do it at home in front of the TV, on the sofa, in the car, or on the floor. Progressive muscular relaxation. By learning to relax your muscles, you can use your body to dissipate stress. Progressive muscle relaxation concentrates sequentially on the major muscle groups. Tensions in the muscles should be maintained for 20 seconds before releasing. Work your facial muscles first. You should be comfortable laying down on a firm mattress or mat. Until you learn the routine, have a friend recite the directions or listen to them on a tape that you can pre-record. You should wrinkle your nose and flare your nostrils. Keep calm and relax. Wrinkles your forehead and arch your eyebrows. The tongue should be against the roof of your mouth. The entire routine should take between 12 and 15 minutes. Practice twice daily, expecting to master the technique and experience some relief from stress in about 2 weeks. The technique is designed to relax the body. By relaxing your mind and body, it is supposed to help you reduce stress. Exercise, health, and stress. Exercise reduces the risk of heart attack, stroke, diabetes, colon cancer, osteoporosis, and fractures, as well as depression and memory loss and dementia. To walk at least 2 miles a day or do the equivalent of another activity. Add a little strength training and stretching twice a week, and you will have an excellent balanced program for health and stress relief. Exercise prolongs life and increases energy. Then it doesn't necessarily mean going to the gym or running a marathon. It means 30 to 40 minutes of moderate exercise, such as walking or vigorous exercise. If you can do it in 10 to 15-minute chunks, you can take it all at once. Other mental health benefits of exercise. Despite not having a mental health problem, regular physical activity can still offer a welcome boost to your mood and mental well-being. Exercise promotes the growth of new brain cells and helps prevent age-related decline. When you meet even small exercise goals, you will feel a sense of accomplishment. Even small amounts of exercise can help regulate your sleep patterns. Yoga and gentle stretching can help promote sleep if you prefer to exercise at night. In addition, if you increase your heart rate several times a week, it will help you get up and go. Exercise can help you build resilience and cope in a healthy way when faced with mental or emotional challenges in life, instead of resorting to alcohol or other negative behaviors that ultimately only make your symptoms worse. Regular exercise can help boost your immune system and reduce stress. Regular exercise also can help your body fight off infections. Tips on dog exercise. Go for a walk around the block is a great start, and it might be enough for some breeds with less exercise requirements. And even couch potatoes appreciate variety every once in a while, and there are countless opportunities to exercise your dog. Dogs love the outdoors as much as you do. Go hiking with your dog, or explore new parks and trails in your area. Many dogs go with their owners when they ride a bike. As a first step when training your dog for this new activity, be sure to skate in an enclosed area and always wear appropriate safety gear. Swimming is great for dogs with joint problems as it provides low-impact exercise, and most dogs love water. It can help your dog stay in the water longer for an optimal cardio workout. Make your dogs run a fill to retrieve a ball. It might seem like an exercise when first glance, but practicing retrieving And reinforcing basic commands offers mental stimulation as well as exercise. Larger dogs like to work, whether it involves a sled, a cart, or skiing. Your dog can learn new tricks such as weaving and spinning. You can do this with a guide dog for the first time. Getting started with exercise when you have a mental health issue. Schedule workouts at the time when your energy is highest. If you feel tired and unmotivated all day, try dancing to some music or going for a walk. Even a short walk can help clear your mind and improve your mood. If you are under the cloud of anxiety or depression and haven't exercised for a long time, setting ambitious goals like completing a marathon or working out for an hour every morning will only leave you more depressed. What gets you moving counts. Wear comfortable clothing and choose a setting that you find soothing or energizing. It can be great ways to start moving more when you have a mood disorder as well as help you become more active. The companionship can be just as important as the exercise when you are suffering from a mood disorder like depression. It can give you a boost of confidence. Easy ways to move more that don't involve the gym. Think of physical activity as a lifestyle rather than just a task to be completed. Clean the house, clean the car, tend to the garden, mow the lawn, or sweep the sidewalk with a broom. If you want to walk to an appointment, use the stairs instead of elevators, walk to the bus stop early, park at the back of the lot, or take a vigorous walk. You can do it. Pick fruit at an apple farm, bougie to music, go to the beach, take a hike, or take a class in martial arts, dance, or yoga. Get active at work or on the go. Thank you for watching. Do subscribe, like, and share.